Bismillahirrahmanirrahim. In the name of Allah, the most merciful, the most beneficent. I am vet doctor Muhammad Sattar Ahmad from Lahore, Nansuk, Fulmandi. And today we are going to discuss a very serious and fatal disease of dog. Because we consider dogs as a family members, and most of the houses and homes are equipped with this loyal animal. We love these animals as a friend, and today we are going to discuss a very serious fatal disease of puppies and dogs, that is canine parvovirus. This disease most of the time we see in puppies age 6 to 8 weeks, and also we observe this disease at the age of 6 months. And as you know better than me, antibodies present in the puppies of the age of 6 months they retain, but after 6 months these antibodies are not sufficient in amount to tackle, to interfere, to prevent, to combat with this virus. This disease is considered the disease of GIT, gastrointestinal tract infection, and CP1, canine parvovirus type 2, most of the time is involved in infection, and most of the time this DNA virus, which is highly pH and thermostable. It means this virus can tolerate high pH, and also most of the time harsh environment can be tolerated to cause infection in puppies and dogs. And you may know the large breeds of the dogs, especially Rottweiler, American Pit Bull Terrier, German Shepherds, and Doberman. These are the diseases, these are the animals which are most of the time suffering from this disease. Number one, Rottweiler, as you know, very big breed, large, and German Shepherd is also large breed, Bull Terrier, German Shepherds, and Doberman. These 4 breeds most of the time we see they are infected with this very fatal virus, canine parvovirus. But unfortunately, this virus do not infect, if affect very minimum stage, small tenure. Small breeds are not susceptible, and mortality rates may reach up to 16 to 48%. 16 to 48% of the dogs may infected by this parvovirus. And if we look what is the transmission of this disease may be transmitted through 2 ways. One is direct, second is indirect. And yes, we are concerned with 3 peoples, and I am grateful for the people which are participating in this live session of my YouTube video, and I hope you may type, chat, and I will try my best to answer your questions, direct and indirect. And case fatality 16 to 48%. Animals are infected, and most of the times, unfortunately, if you have puppy which they may infected by this virus, and if once your puppy is infected by this fatal virus, it may carry about whole life, and the infected animal may not survive healthy as compared to other animals which are healthy. So there is two types how this virus can be transmitted from one to other animals, direct and indirect. That ways, one is if your puppy, your dog is healthy and you take with you for walking, and if unfortunately your animals sniff or eat those grass, those places which are already infected by the virus, then this virus may infect your puppy. Indirect way, this virus, if an animal is suffering from this disease, parvovirus, and the used materials, bedding, utensils, feed, water, these may contaminate other animals, and if healthy animals take or use these infected utensils, then your healthy puppy may infect by this virus. This is indirect way of transmission of this disease, parvovirus. Now, third day of infection, the feces may contain this virus, and up to 3 weeks can be taken. You may observe the feces of the animals may contain virus, and if these feces are spread, or your healthy dog may reach, then may infect it and become unhealthy or diseased. Now we go ahead and discuss the pathogenesis, how this virus is brutally infect your puppy, innocent puppy. Virus ingestion by the oropharynx route, viral replication in the lymphoid tissues, oropharynx, virus enter into the bloodstream, and when this virus has reached in the bloodstream, then there is viremia, because this virus has reached in the bloodstream, viremia, and attacked, and this virus will attack rapidly dividing cells of the body, for example bone marrow, lymphoid tissue, crypts of the epithelial cells of the jejunum and the ileums, so cause enteritis. There is inflammation of the intestine of the animals, and if there is enteritis, then there is bloody diarrhea. So secondary infection by E. coli and Clostridium perfringens cause secondary bacterial infection. So the replication of the virus in bone marrow, lymphatic tissues, can cause neutropenia. There is deficiency of the neutrophils, and the lymphopenia, deficiency of the lymphocytes. And at third day of the infection, the intestinal crypts of epithelial cells may slough, and they may come in the feces. So at this time, virus shedding in the feces starts and ends at 10 to 14 days after infection. Thank you so much. You are connected with me. Thank you so much. You people are watching me and you are appreciating me. Thank you so much. Now, when there is sloughing of the epithelial crypts of the intestine, then infection and its replication of the virus in the crypts of the intestine, epithelial cells of the intestine, and there is damage of epithelium is destroyed or necrotized, and there is hemorrhagic diarrhea. Secondary bacterial infection, along with this diarrhea, infection cause severe enteritis. Now, this was a very brief process of pathogenesis, how virus from oropharynx, then intestine is involved, and the intestinal tract, especially the ileum, jejunum, the crypts, epithelial cells are destroyed, and when there is sloughing of crypts of the epithelial cells and there is enteritis forms, then your dog is continuously losing electrolytes, and along with electrolytes there is also deficiency of the water. And when there is no secondary bacterial infection, dog remains asymptomatic. It means until your dog has no secondary bacterial infection, these symptoms are not visible, but virus is still present in the body of the dogs, and after the diarrhea, along with diarrhea, there is a loss of electrolytes and waters, and your cute puppy, your member, may become lethargic. Now, what are the major factors affecting this disease? Number one, stress factor. If your environment, you have puppy and puppy is surrounded by these factors, if stress mean environment is not good, there's no proper ventilation, airy environment, then your cute puppy, innocent puppy, may infect more than other. And number two is the nutritional status. If your animal is healthy, eating good diet, then he is able to cope, to fight against this virus, and may survive long times than an emaciated one. Yes, thank you so much for watching, and we are still continuing, and 9 people are connected with me, and thank you so much for liking, sharing this. No, number one, stress factor, environmental stress. Second is nutritional status of the animals, and third is the secondary bacterial infection. Until secondary bacterial infection, if there is no infection, your dog still not showing any sign, asymptomatic, but he is taking food, he may survive. Number 4, ingestion of the virus. How much quantity, how much number of viruses are ingested by the animals? More quantity, rapid infection; less quantity, slow process of the disease in this case. And if we discuss the incubation period of this parvovirus infection, incubation period is 3 to 8 days. 3 to 8 days when clinical stage appear. And clinical forms, 2 clinical forms are there. Number 1, myocardial form. Myocardial, it means heart is involved. And second is gastroenteritis form, mostly observed in the neonates. This form, myocardial infection, myocardial form, is observed in neonates, puppies, about 1 to, it means most of the time this disease is involved in first month, because there is not good sufficient amount of antibodies, no strong immune system of your cute puppy, and this virus has opportunity to destroy, to infect your puppy. Go ahead. There is in utero infection. It means if the mother of this puppy already had infection inside the uterus, then after giving delivery, your puppy may contain direct infection from her mother, because there is in utero infection. Now, maternal antibodies decreases at the age of 6 months. So there is enteritis occur, and myocardial infection. Myocardial forms acute cardiopulmonary failure when there is involvement of lungs along with the heart. Then this disease become more fatal, severe form. Sorry for coughing. Pulmonary edema is there. When there is pulmonary edema, puppy may feel difficulty in breathing. Sinuses, there is deficiency of the RBC, WBC, neutrophils, basophils, and there is sinuses, peeling of the face organs, conjunctiva or oral mucosa of the animals, and collapse. Your animal may collapse. Cardiac insufficiency. This cardioenteritis form common in those pups more than 6 to 20 weeks of age. It means this form cardioenteritis. 2 systems are involved, heart and the intestines of the in animals, that is at the age of 6 to 20 weeks, and this form is characterized by high rise of the body temperature. You may observe your puppy is panting, more temperature is there, high rise of the body temperature, 104 to 105 Fahrenheit temperature, profuse type of the vomiting, diarrhea, anorexia, acute onset dehydration, lethargy, and incoordination, imbalance of the acid base. Feces become yellowish to gray. You may observe the feces of your puppy first yellow, and may change from yellow to gray, and along with this it may contain mucus along with the diarrhea, or may contain blood. At 6 to 20 weeks, maternal antibodies are decreased, because at the age of 6 months, still this age contains sufficient amount of antibodies gained from the mother, but after 6 months, these antibodies rapidly decreased and more chances of infection of this parvovirus, and there is secondary bacterial infection by Clostridium perfringens, E. coli. Okay, go ahead. Severe forms. If no vaccination, unfortunately, there is no infection. If your puppy has already immunized, or you have inserted a vaccination schedule, if you have followed, but unfortunately, if you have not injected this vaccine, a parvovirus, then there is more chances of brutally and fatally death of your puppy. So vaccination must be done if you care your puppy. So enteritis is more in female animals. It means gastroenteritis is more in female puppy, and the death of the animals 10 to 12, or in neonates, it means 10 to 12 are the sufficient time to destroy by the virus. Your cute puppy may die due to the severe myocarditis, along with fewer of the infection. Now we come to the point how we can prevent this fatal disease. Prevention is better than cure. Many diseases we can prevent only and only by the biosecurity measures, good hygienic condition, good environment. If we provide good and healthy balanced diet for your puppy, and if we follow vaccination schedule, then there are less chances of your puppy to die, because you people care, love your puppy, and you most of the time care for this. Now we want to treat this disease after observing the symptoms. Number one symptom, lethargic, secondary bacterial infection, and when there is secondary bacterial infection, there is vomiting, diarrhea, anorexia, collapse. Then we have to treat this beautiful creature, our friend puppy. Number one, we provide ranitidine to correct acid base of the body. Number one, ranitidine 2 to 4 milligram per kg body of the weight. We may inject ranitidine IV according to the body weight, 2 to 4 milligram per kg body of the weight. Flunixin meglumine, this is my favorite salt I am using in the field, also in cattle, buffalo, sheep, goat, and in feline cats or canine in puppies. Flunixin meglumine 1 milligram per kg body of the weight. OD once a day. Number 1 precautionary measures is the isolation of the infected animal. As early as possible, if you observe any one symptoms of your puppy, please separate your puppy from other animals, because your other animals may be infected by these infected animals. So isolation of the infected animal is number 1. Number 2, restoration of the body fluids by fluid therapy, ORS, oral rehydration solution in severe dehydration. And I would like to say and apologize and request, if you observe any one symptoms among these, contact with your veterinarian and visit your veterinarian so your puppy may survive, your puppy may be saved. Fluid therapy, severe dehydration, lactating solutions. We are also, for example, 5% we use dextrose, because in this condition there is deficiency of sugars. We use 5% dextrose IV along with additional form of the KCl, potassium chloride, because there is diarrhea, vomiting, and these potassium and chlorides are lost, and we want to restore these electrolytes and antiemetics to prevent the vomiting. Metoclopramide we used as we trade name Mepzolon, Gravinate 0.2, 0.5, from 0.2 to 0.5 milligram per kg body of the weight per oral 4 times in a day, or chlorpromazine 0.5 milligram per kg body of the weight intramuscular to depress the medulla. We may use this chlorpromazine 0.5 milligram per kg body of the weight to depress the mental depression. Antibodies will come in the body of the animals after vaccination, but along with diarrhea, vomiting, lethargy, loss of electrolytes, as potassium chloride we are adding dextrose to provide energy, and along this we also want to restore the hydration status of your animals. So 5% dextrose, KCl, and to depress the medulla we use this chlorpromazine. Antibiotics, first and second generation of the cephalosporins combination along with the aminoglycosides, for example gentamicin, streptomycin, or the enrofloxacins are useful. Safety for sodium, very excellent salt. We are most of the time using this safety for sodium 2.2 to 4.4 milligram per kg body of the weight, IM or subcut, and metoclopramide to prevent vomiting 1 to 2 milligram per kg body of the body weight, very slow IV. So gastric protector, intestines covering mucosa to save we may use cimetidine, ranitidine. So this one, cimetidine, 5 to 10 milligram body of the weight, and repeat this cimetidine at the dose rate of 5 to 10 milligram per kg body of the weight, IV or IM, after 6 hours. So I hope this was a brief introduction of this disease, but this is a very fatal disease. If we ignore, we don't follow vaccination schedule, a cute loved one, beautiful animal may collapse or may disappear forever. So we should always follow these instructions to save the lives of the canine family. Thank you so much for watching. If you have any question, you may ask. I will try my best to answer in this chat. So along with this word, try to prepare for the life after your death, because kullu nafsin zaikatul maut. We have to face, we have to taste the taste of death after our completion of tenure lifespan. Thank you so much for watching. Assalamu alaikum wa rahmatullah.
Kini ay ha? Ha? Kini ay ha?